Hi, my name is Devin Corbiny. I have chosen to apply to a doctorate level nursing degree rather than the master's program, and the difference to me, though both are extremely educational in my opinion, the doctorate program goes more in depth regarding advanced clinical research to provide evidence-based practice for patient care. Whereas the traditional MSN program, research is study, however, clinical practice and skills are more of a focus. DNP programs also prepare nurses to be leaders involving practice and research. Building upon the MSN level of education, doctor-prepared nurses are encouraged for the research they have done and studied to be incorporated in daily care for best practice and a higher quality of patient care. As mentioned, DNP programs also focus in depth on leadership and management skills. Most of my nursing career has been spent on an observation unit. On this unit, I've been able to see a wide range of patient care and symptoms and diagnoses. This has helped me build my confidence in providing quality care to patients through educating them on best life practices to improve their health, keeping them safe, and advocating for their care. My unit is mostly staffed by nurse practitioners. Working side by side with them has allowed me to see the impact they do with providing evidence-based patient-centered care. I have been motivated to advance my career so that I can do the same. I'm also involved in different committees at the hospital, one of which meets with the hospital's chief of nursing once a month to talk about ways to improve patient care and their experiences. All these things have really pushed me to advance my career to get my DNP. Last year, my unit left the medical surgical division and became sister units with the emergency department. With this happening, I've been able to cross-train in the ER, which has been amazing. My critical thinking skills have grown, being in a fast-paced environment, as well as my knowledge and nursing skills. My hospital is also currently working on getting geriatric certified. Doing the training provided to us for this has increased my quality of care for this population of patients. My hospital also doesn't have a dedicated psychiatric unit at this moment, which means I get a lot of experience dealing with the mental health population. Taking care of different patients from all age groups, from different walks of life, as well as being from a small town and then going to different colleges with diverse populations, I have learned that people from different backgrounds, age groups, cultures, and economic backgrounds approach healthcare and their well-being in different ways. I understand that their wishes and cultural differences should be respected. When I attended UNC Wilmington's RN to BSN program, I took a class called Complementary and Alternative Therapies, which gave me a newfound appreciation for different cultures and practices, and a holistic way of thinking that I incorporate into my patient practice today. Over the years working with diverse populations, I have learned the importance of therapeutic conversation skills as well as the importance of educating my patients. My grandpa was put in in-house hospice care. The time the nurses and the NPs took to educate us all on the medications that he would be taking and how the next weeks would look involving his care strengthened my understanding of how important nurses' role in patient care in all aspects of nursing is important. Education is a huge part of care we provide in hopes to prevent patients' health from declining and to instill positive preventative measures. One of my favorite parts of being a nurse is educating my patients and on simple things that can positively impact their health. That's why becoming a DNP prepared family nurse practitioner is so important to me because I can change the quality of patients' life. A long-term goal I've had is becoming a nurse. While taking prerequisites, I researched different schools and met with their admissions advisors to figure out which school was the best fit for me. When I found a program I liked, I was so excited to get started. That is until an obstacle came that no one expected, the pandemic. I went to school one day and never went back to campus. I was working at the time in a chemistry lab, which never shut down, so I was often concerned that I would get sick. I had to find a new way and a place to study due to not being allowed back on campus. Thankfully, I was able to create a new study plan and Zoomed with my study group. When I passed my last test, I felt so relieved. Now it was time for me to start studying for the NCLEX so I could achieve my goal of becoming an RN. Just when I scheduled my NCLEX, I realized how weak I felt. Into now at the idea I could possibly be sick. I was so focused on studying. I decided to get tested as my symptoms progressed. I tested positive for COVID on Christmas Eve. Now I would have to wait another month and a half before I could take my NCLEX and become a nurse. When I passed the NCLEX, a weight was lifted from my shoulders. I had achieved my goal of becoming a nurse. Becoming a nurse has been such a rewarding career for me, and I am so thankful I went back to school for this profession. Becoming a DNP prepared nurse practitioner is important to me so that way I can increase the level of care that I provide to my patients. I look forward to achieving this next goal. Thank you for your time. Goodbye.